right, so our first question is, how would you describe a virus?
I would describe a virus as something that's a global pandemic that can affect a lot of people regionally and globally as well.
Something that gets you sick, like something that like, you can be infected with.
A non-living pathogen.
I'm not quite sure, but I'm gonna think like a disease or something.
Define a virus as like any type of like bacteria that can cause a disease, I guess.
It's something that spreads.
Something that cannot be cured by antibiotics.
Something that happens when you're sick.
Something like the insidious that like makes you sick, and that's very hard to treat.
Why are certain viruses so hard to treat? For example, AIDS.
Because you can't kill them.
I have no idea. I just like don't know.
Because there's just so much.
Not sure.
I'd say because it's too damaging to the body, so you cannot cure the whole disease.
Because they're resistant to certain drugs, and so you just kind of have to like let them run through your body. You can't really get rid of them.
Don't they mutate often?
Because they're constantly evolving.
AIDS.
I would say because in certain countries, like developing countries where AIDS is an epidemic, they don't have the medical treatment that they need, and further, they don't have doctors coming in that they really need to help assist these programs. As a result, these can spread to numerous amounts of people because they're
How
never
does this
contained.
affect the type of treatment given, do you think?
I suppose you have to keep treating it with different drugs, so you can stop the evolution.
Because it can spread so rapidly, and because of all the different strains that can evolve over time, that makes it really difficult.
Because you can't figure out how to like fully kill it. Like I don't know.
Okay.
I have no idea.
Probably makes like it's probably a lot of like guess and check. I'd imagine. I don't know, like trial and error. There's no like real significant like definite treatment, but like they're just testing new things on everyone and hoping it works.
I honestly have no idea.
Well, if they mutate, doesn't it change? So then, like the initial like treatment won't work. It changes, right?
So we can figure out ways to treat the whole thing.
Well, I guess it would depend on like the type of virus, and you might just need to do like preventative care, or just like I don't know, like keeping it comfortable, like to wait it out.
Okay. Do you have any idea what antiretroviral therapy is?
No.
If you were to take a guess, what do you think it would be?
What's it called? Antiviral.
Antiretroviral therapy.
Just like I don't know. I don't know what that could possibly be. Like fixing a virus? Like,
No, I do not.
Putting another virus in that will attack the bad virus.
Some type of therapy.
Therapy that treats viruses. Yeah.
Something that prevents viruses from happening.
Using like old viruses to kind of like build up immunity. To
Have you ever
treat
heard of
viruses.
antiretroviral therapy before? How do you think that's used to treat AIDS, do you think?
Repeat the name of that therapy.
Antiretroviral therapy.
I have no clue.
It probably is a more holistic approach. So instead of just going into one area and then trying to treat it, it probably does it into numerous areas all at the same time, so it doesn't increase the spreading rates.
to treat AIDS.
Uh-huh.
It would attack the AIDS virus and disrupt it.
I don't know, just some sort of medicine that you could take to help counter it, I guess.
Maybe it like helps people not treat. I don't know.
Preventing it.
Is it used kind of like a vaccine to try to combat people getting AIDS?